Okay, so welcome everyone to the second webinar in OvoLife's Reproductive Health series. After our first session, many of you reached out with one big question, which was, what about the male side of fertility? So today, by popular request, we're diving into a topic that's often left out of the conversation, and that is male fertility, and why it's just as important when thinking about your reproductive future. There's a widespread myth that men can have children whenever they want. No age limit, no complications. But the reality is more complex. Sperm health, age, lifestyle, and medical conditions all play a role in fertility outcomes. And they impact us women too, whether we're trying to conceive now or preserving fertility for the future. So let's explore the science, break some myths, and talk about what you and your partners should know, because understanding male fertility is a powerful step in owning your reproductive journey. We'll explore the male reproductive system and talk a bit about sperm production, as well as some of the hormones that are involved in the process. We'll look at some sperm health, age, and lifestyle factors that can affect conception and even influence a woman's decision around egg freezing or fertility treatments. We'll cover some of the male fertility tests that are available, and we'll finish off with what women should know about male fertility to help understand and maneuver their journeys to parenthood. We'll have some time at the end for Q&A, and you can always contact me directly if you have any questions after the webinar. Okay, so let's take a moment to refresh our memory on the male reproductive system. You've probably seen a diagram like this at some point, maybe in school sex ed classes, or maybe when looking into fertility. But it's worth revisiting the key players here. Starting with the testes, these are the primary sperm production centers. Inside them are tiny structures called seminiferous tubules, where new sperm are constantly being made. From there, sperm move into the epididymis, which is a long coiled tube sitting just behind each testicle. This is where sperm matures and is stored until ejaculation. When ejaculation happens, sperm are pushed through the vas deferens, which is a muscular tube that transports them towards the urethra. On the way, the sperm pick up some very important fluids from the seminal vesicles and prostate gland, which help provide nutrients and protections, and this forms the semen that carries the sperm. Finally, the urethra, which runs through the penis, is the exit route for the semen during ejaculation. Now that we've covered the key organs, let's zoom in on what's really going on inside, the fascinating process of sperm production, which is also known as spermatogenesis. So how do these tiny swimmers come to life? It all starts in the seminiferous tubules, which are those tightly coiled structures inside the testes. Picture them like microscopic factories with sperm stem cells hanging out on the outer edges, ready to get to work. These stem cells go through a series of divisions and transformations, gradually becoming mature sperm. But they don't do it alone. There's special helper cells inside the tubules, which help with feeding, guiding, and giving structure so that the sperm can grow and develop properly. Once they're formed, the sperm move into the epididymis, where they gain the ability to swim and get prepped for their big moment, which is ejaculation. The whole process takes about 3 months, so any changes in lifestyle today can impact sperm health a few months down the line. And here's the wild part. A healthy male can produce millions of sperm every single day. In just one ejaculation, there can be 15 million to over 200 million sperm per milliliter, with the total volume of semen being around 2 to 5 milliliters. That's a whole lot of sperm heading out to fertilize one egg. It's a constant operation that kicks off at puberty and continues nonstop, making sperm production one of the body's most impressive ongoing processes. All right, so sperm production isn't just some solo act happening in isolation. It's actually a team effort controlled by hormones. This whole process is regulated by a finely tuned system called the hypothalamic pituitary gonadal axis. Basically, this is your body's fertility command center. And here's how it plays out. So it all kicks off in the brain, where the hypothalamus releases a hormone called GnRH, which is short for gonadotropin-releasing hormone. GnRH then travels a short distance to the pituitary gland in the brain that responds by releasing two key hormones. One is FSH, or follicle stimulating hormone, which heads straight to the Sertoli cells in the testes. And think of Sertoli cells as these sperm coaches. So they support and nourish sperm as they develop. The other hormone is LH, or luteinizing hormone, which tells the other cells in the testes to produce testosterone, which is absolutely essential for keeping sperm production running smoothly. Testosterone and FSH work together like co-captains. Without enough testosterone, sperm production slows down, and that's a big problem. Luckily, the body is pretty smart, so it uses a feedback loop to keep everything in check. If testosterone levels climb too high, the brain gets the memo and it dials back GnRH, which lowers FSH and LH too, and that in turn lowers testosterone, and it works in the reverse as well. But here's the catch. When this normal hormonal harmony is disrupted, whether that's from stress, illness, medication, or steroid use, it can throw the whole sperm production process off track. And that can seriously affect sperm count and quality. The bottom line here is that hormones are important, and when they're off, everything else feels the impact as well. Now let's look at some sperm parameters to evaluate the health of sperm. According to the World Health Organization, here are the main parameters of sperm to consider. Sperm concentration refers to the number of sperm per milliliter of semen, and a normal concentration is 15 million sperm per milliliter or more. Lower numbers can make natural conception more difficult. Total sperm count is the total number of sperm in the entire ejaculate. A normal count is at least 39 million sperm per ejaculation. Motility tells us how well the sperm move. At least 40% of sperm should be motile, and ideally 32% or more should show progressive movement, which means that they're moving in a circular forward motion. This is important because sperm that don't move properly can't reach the egg and therefore can't fertilize it. Morphology measures the percentage of sperm with a normal shape. Normal morphology is when 4% or more of the sperm in a semen sample have ideal structure, which is an oval head, normal-looking midpiece, and a straight tail. Abnormal shapes are quite common and occur often, which is why anything over 4% is considered normal. But too many abnormalities can reduce chances of fertilization. Volume refers to how much semen is produced in one ejaculation. So normal volumes range from 1.5 to 5 milliliters. Sorry, one second. And low volume could suggest a blockage or issue with the glands that produce semen. Sorry, someone is trying to join, so just give me 1 second. Okay. Liquefaction time is another parameter that's also important. So semen, when it's produced, is initially thick and it should liquefy within 60 minutes. So delays in liquefaction can affect sperm movement. Together, all of these parameters provide valuable insight into a man's fertility potential. There are other parameters as well, but these are the most common ones to consider initially. If any of these values do fall outside the normal range, it doesn't always necessarily mean infertility. It just might suggest the need for further evaluation or some interventions. Now, what happens if sperm parameters are not ideal? Poor sperm health can have a significant impact on a couple's ability to conceive and maintain a healthy pregnancy. So let's break down some of the key effects. There's lower chances of conception. So if sperm count is low, if they aren't moving properly, or if many of them are abnormal, it becomes more difficult for them to reach and fertilize the egg, which can make natural conception take longer or not happen at all without interventions. There's higher risk of miscarriage. So some research shows that poor sperm quality, especially when there's DNA damage, can increase the risk of miscarriage. So even if fertilization occurs, the embryo might not develop normally, resulting in the loss of the embryo early on during pregnancy. There's impact on embryo quality. So sperm contributes half of the genetic material to an embryo. If the DNA inside the sperm is damaged or fragmented, it can lead to poor embryo development, affecting outcomes even when going through interventions. And there's challenges with fertility treatments. So in cases of very poor sperm health, even assisted reproductive technologies like IUI or IVF may be less effective, or additional techniques may be needed to help. It also has effects on the female partner's health. So poor sperm quality can indirectly impact the woman's reproductive health by increasing the emotional, physical, and financial burden of repeated unsuccessful attempts or treatments. So while fertility is often seen as a woman's issue, male factors play a critical role, and improving sperm health can make a big difference in outcomes for both partners. So the male partner should always be part of the conversation so they understand their role and the importance of having good quality sperm. Now let's look at the effects of lifestyle and age on sperm. When it comes to fertility, women often get all the attention about the biological clock, but that doesn't mean that guys are off the hook here. Unlike women who are born with a finite number of eggs, most men produce sperm continuously throughout their lifetime. This sounds like a win, right? Well, not exactly. That's not how it works. As men get older, especially after the age of 40, things start to shift. Here's what age can do to male fertility. So it can lower sperm quality. The three big sperm parameters, count, movement, and shape, can all take a hit. That means that fewer sperm, there's slower swimmers, and there are more abnormal ones. That's not great for conception, and it's definitely not ideal for assisted reproductive treatments either. There's more DNA damage, so as sperm ages, so does its genetic material. DNA fragmentation increases, which can impact embryo development and raise the risk of miscarriage. There's increased age can result in longer time to conceive. So even if the female partner is younger and healthy, having an older male partner can stretch out the time it takes to get pregnant. And there are increased health risks. So advanced paternal age has been linked to a higher risk of rare genetic mutations, neurodevelopmental conditions like autism, and even some mental health disorders in children. So yes, while men don't have a hard expiration date for fertility, age still matters. So if you're considering building a family in the future, it's smart to think about sperm health now rather than later. Our everyday choices can have a big impact on sperm health as well, sometimes more than we actually realize. So let's look at some key lifestyle factors that can influence male fertility. Smoking. So cigarette smoke contains toxins that can reduce sperm count, slow motility, and damage DNA. It's one of the biggest lifestyle factors linked to poor sperm quality. Alcohol. Excessive alcohol drinking can lower testosterone levels and it can decrease sperm production. Even moderate alcohol use may affect hormone balance over time. Diet and weight. So a diet in processed foods and low in nutrients can impair sperm health. Being overweight or obese is also linked to reduced sperm count and increased DNA fragmentation. Heat exposure. Sperm production works best at a few degrees below body temperature. That's why the testicles sit outside of the body. Regular use of hot tubs, saunas, or even placing laptops on the lap for long periods can reduce sperm quality. Stress is another factor, so chronic stress can suppress testosterone and impair sperm production. Drug use is another factor. Anabolic steroids, marijuana, and some recreational drugs can have a serious negative impact on sperm production and quality as well. The good news here is that many of these effects are reversible, especially since sperm production is continuous. So positive lifestyle changes like quitting smoking, improving your diet, and reducing stress can lead to better sperm health in just a few months. So adapting a healthy lifestyle might be able to help improve some of these parameters. It's not a guarantee, but it can definitely help. There are some tests available to check sperm quality, and I'll go over these now. So male fertility testing is just as important as female fertility testing because male factors contribute to nearly 40 to 50% of all infertility cases. The first and most common test is the semen analysis. The simple test looks at key sperm parameters, including sperm count, which is how many sperm are present in the sample, motility, which is how well the sperm move, morphology, the shape and structure of the sperm, and volume, which is the overall fluid amount, which can impact sperm survival. For a semen analysis, the sample is typically collected through masturbation after 2 to 5 days of abstinence, either at a clinic or at home, depending on what the patient is comfortable with. And then depending on the results, a doctor may recommend repeat testing. That's usually done if the patient has had a recent infection or has made some lifestyle changes, such as stopping steroid use or smoking. This is all because in some cases, sperm parameters can vary in a few months. Additional evaluations may be necessary as well if that initial semen analysis is not normal. So hormone testing to check testosterone and other reproductive hormones, scrotal ultrasound to examine the testicles and nearby structures, genetic testing, especially if sperm count is very low or absent, or DNA fragmentation tests, which look at sperm quality on a deeper level, looking at the DNA of the sperm. So these are all tests that are available, and getting tested early on can save time, it can guide treatment, and it can empower both partners with a clearer understanding of their options. It's a small step that can make a big difference. Here's the good news. When it comes to male fertility, there are some options when it comes to treatment, and they're not all high tech or high stress. So treatment depends on what's causing the issue, and it could be as simple as swapping out some bad habits. Let's break it down a little bit here. So I'll start with the basics, which are lifestyle fixes. Sometimes the problem isn't actually in the testicle, it's in your day-to-day habits. So again, smoking, heavy drinking, poor diet, obesity, or even too much time in the hot tub can mess with sperm health. The silver lining here is that healthy changes can lead to better sperm in just a few months. So a little broccoli here and fewer beers could actually go a long way. Medical treatments are available. So if hormones are out of balance, meds can help get things back on track. So if there's an infection, antibiotics might be prescribed. Sometimes anti-inflammatories or antioxidants are also part of the medical treatment plan as well. There are some surgical options available. So in cases where there's a physical issue, like a blockage or a varicocele is when veins in the scrotum get too big and warm. Surgery might be the solution here. So procedures like varicosilectomy can improve sperm quality in some men. There are assisted reproductive technologies, of course. So if sperm count is really low or other treatments haven't worked, ART steps in, and that includes IUI, which is intrauterine insemination. So the sperm gets a head start by being directly placed into the uterus. There's IVF, in vitro fertilization, which combines egg and sperm in a lab, and then ICSI can be added onto IVF, which is intracytoplasmic sperm injection, where a single sperm is chosen and injected into the egg. There's sperm retrieval techniques available. So for men that have zero sperm in the ejaculate, techniques like TISA or micro TISA can help retrieve sperm directly from the testicles. And those are usually used for IVF cases. I know it sounds really intense, but it's not that bad, and it's helped create many families. So it is definitely an option. The most important thing here is that every treatment plan should be personalized based on a full fertility assessment. So men need to be part of the conversation when it comes to fertility, not only for their own health, but so the burden of fertility doesn't fall entirely on the woman. So now that we've had a look at male fertility, specifically sperm, let's focus on the woman's side and what we need to know. When we talk about fertility, the focus often falls heavily on women, but it's important to remember that fertility is a shared responsibility. Male factors play a role in nearly half of all infertility cases, and understanding this can make a huge difference in planning and decision making. So even if a woman is young and healthy, poor sperm quality can impact the ability to conceive naturally or even with assisted reproductive techniques. For example, low sperm motility or abnormal morphology can lower the chances of fertilization, and high levels of sperm DNA damage have been linked to miscarriage. So if you're considering egg freezing, sperm quality will still be important down the road, whether you're planning to use a future partner's sperm or a donor. It's a good idea to start that conversation early, especially if you're in a relationship and you're thinking about starting a family one day. Women should also feel empowered to ask their partners, current partners, or future partners about their reproductive health. So just like we encourage women to check their fertility, men should also be encouraged to get tested if there are concerns. And by understanding the male side of fertility, women are better equipped to advocate for themselves and make informed choices about their reproductive futures. So when you're thinking about your future fertility, it's important to include your partner in that conversation early and openly. Fertility is a shared journey, and creating that space to talk about it can help you feel more prepared, supported, and aligned. Not just you, your partner as well, because it's a taboo topic, so men usually don't like to bring up these conversations. But if you do, then it makes them feel supported and able to talk about these things as well. So here are some things that you could start asking to kind of start that conversation. So you could start with asking if they've ever had a sperm test before, if they would be open to checking their fertility health, if they know if infertility runs in their family, if they feel ready or if they've ever thought about starting a family one day. So these questions don't have to feel clinical or pressured. They're just about getting to know each other's values, goals, and timelines. So, for example, if you're planning to freeze your eggs, it might also help to ask, like, if we were to use your sperm one day, would you consider doing a test now to make sure everything's okay? Would you be willing to use your sperm later in the future? So these are all really good questions. There's multiple ways you can bring that up, but these are good ways to get that conversation started. So it's good to remember that sperm quality can change over time, and it is affected by things like age, lifestyle, and medical history. So asking these questions early gives you more time to plan, adapt, and make empowered decisions together. So let's look at some next steps before we open to questions. Now that you've got a clearer picture of how male fertility plays a role in your reproductive health, it's time to think about what you can do with this knowledge. So again, start the conversation. Whether it's with your partner, a close friend, or a healthcare provider, don't be shy. Fertility shouldn't be and is not a taboo topic, and asking questions is one of the most powerful things you can do. So, what you've learned here today could actually even help someone else start their journey. So, keep bringing up these conversations and talking about fertility. Consider getting a fertility checkup. So, if you're curious about where you and your partner stand, a fertility check doesn't mean you're committing to anything, it just gives you clarity. For men, a semen analysis is a quick and simple way of doing it. And for women, there's ways to assess their fertility as well, like ovarian reserve and reproductive health. Think about your timeline. So you don't need to have it all figured out, but reflecting on your future goals, career, family, relationship, and how fertility might fit into that gives you more control. So it's not about pressure here, it's about possibilities that you could have in the future. And tap into your support system. So remember that you're not alone in this. We at OvoLife are here to guide you every step of the way, whether you're exploring egg freezing, learning about reproductive health, or you're just trying to feel a little more empowered. You can check out our website, you can join our webinar series. So this is the second one, and I'll be doing more in the future, or you can reach out to me anytime with any questions or concerns that you might have. So thank you so much for your attention. And I want you to remember that fertility is not just the woman's issue. We all need to support each other through this journey and make sure that both men and women feel advocated for. So here are my personal contact details if you want to get in touch with me. Like I mentioned, the topic today was actually chosen from a request received after the previous webinar. So we do listen and we want to cover topics that you are interested in. So if there's a specific topic you'd like to hear about, please let us know. I'll open to questions now. You can turn on your mic and ask your questions. I'll look into the chat as well.